MVP is basically a healthcare insurance payer in upstate New York. We have a geography of Buffalo, Western New York. Central New York is Syracuse and Utica. Upstate is considered the Albany area, downstate to Tarrytown, which is just north of New York City. And we also have offices in Vermont and service about 700,000 members. And we have about close to 1,800 employees now, and a number of different, as you can imagine, healthcare benefit plans. And you can also imagine that the churn that experienced over the last year with COVID and how that impacted the insurance agency in healthcare. Next slide. So before we get into the legacy of the provider, let me talk a little bit about the legacy of MVP. I've been here just a little bit over 3.5 years. I came from a provider side. I worked in a hospital for a number of years, technology, doing lots of the same things. When I got here, the technology from a hardware perspective was incredibly antiquated. Network switches couldn't be on SmartNet because they were too old. Servers were 9, 10, 11 years old. Lots of Microsoft 2003 servers, XP, also Windows 7, and we made a migration to Windows 10 in the whole process. But really a very antiquated environment, not just from the hardware layer, but if you go up to the application layer and the data layers, all very antiquated, older SQL environments. The identity and access management solution was a solution that was implemented in 2008. And as Nikhil pointed out in one of his previous slides, that creates all kinds of issues, from high cost of maintenance to supportability to security risk to all kinds of support issues from our team. And so right about the time I got here, in January of 2018, we started a project to evaluate a number of different solutions that were out there, because our infrastructure was so old in terms of this authentication process, and the maintenance that was required was incredibly large. And as Frank pointed out, one of the other issues is because it was so antiquated and old, it took forever to just authenticate in the process, let alone start to then transfer information from our claim system. So as an insurance company, what you need to know is important are claims. And different from a provider where you've got health records and health information, on the payer side, what's important are those claims and getting those claims, what they call adjudicated and processed. And so providers will look at those claims and evaluate different things based on that claim, see how it was paid, things of that nature. And so these four constituents over on the right are really who we deal with. We deal with members, we deal with providers, we deal with brokers. So brokers are just like you've got insurance brokers. They're out there and they're selling our different plans to federal government agencies, state government agencies, local businesses, nationwide businesses, and things of that nature. So you've got brokers that are selling plans, and then you've got employers who could be buying direct as well. And so each of those people have different access points into our core claims systems. And as you can imagine, with a system that was built in 2008 and 2018, 10 years later, the speed at which it processed requests was really, really cumbersomely slow. On top of that, when you look at our web application, our mobile application versus our web application, the rating on our mobile application, I think, was 1.8. So not a lot of high kind of, visibility and success with either the mobile app or the web app because of the legacy code that existed. And it's voluminous. It's not inconsequential. It's very, very significant. And so if you go to the next slide, Justin, we can go down to the next step. I'll talk about this last bullet because I saw it in the previous slide, the multi-factor authentication. We are governed by a number of state agencies and their requirements, as well as a number of federal agencies and their requirements. And one of the requirements certainly is multi-factor authentication. And in that old solution, there was just no way to provide for multi-factor, and we needed to find a new way. And so we started this new journey as I said, when I first got here, to uncover a new way to do identity. And what I should say is that our CISO is very much an advocate of Microsoft and Microsoft technologies. And our feeling is we should start with Microsoft first before we go outside, because we wanted to keep a kind of a single stack. And if we could get Microsoft solutions to drive our technologies, that was where we wanted to go. And as a last resort, we would look to other vendors. And as Frank pointed out, as we start to expand this, there are a number of other ISVs that are out there that we can pull in and really enhance the feature functionality if we choose to, because of the integration with other vendors that are out there, third-party vendors. But for right now, we're really focused in on the Azure B2C components. And what we did was we looked around at a number of different vendors, and because Microsoft is such a good partner of ours, they recommended, I think it was 3 vendors to help us kind of start the journey with a POC. And we brought them in, and it was right as I started, and we ended up selecting Edgile. And we talked through all our requirements, and as you can imagine, you've got those 4 constituency groups: members, providers, brokers, and employers, and each of them has a little bit of a different requirement. But we didn't want to fundamentally change, as Frank pointed out, that UI. We wanted the UIs to be very, very consistent across those constituency groups, as well as when we start to roll this out internally for our own staff. We want that interface to look and feel very similar and have that standardized look and feel. So that was a huge requirement for us. And when you look and you go back into the slide deck, the 6 use cases that Frank pointed out, I think are very, very viable. And they were 6 of ours that, we kind of had to have. So we wanted a similar look and feel. We wanted newer technology. And I think one of the things that Frank pointed out that is very important is the scalability. I don't want to have to deal with buying new hardware and buying new software and more licensing and more of this and more of that. The B2C piece and the Azure environment is exactly as he projected it. It's utility. It's electricity, and the more we use, the more we pay. The less we use, the less we pay. And we do have a very cyclical business as a payer. And that cyclical business is at open enrollment times. And in most cases, with the exception of this year because of COVID and what the president's done in terms of open enrollment really never stopped. But largely, open enrollment starts in October and goes through about the March timeframe, with heavy peak usages at calendar year end and in January. So we will see higher utilizations in those periods than we would at this time of year in June, for example. So we wanted to be able to scale and move accordingly with the cyclical business kind of sojourn that we've got. So that was another requirement. Clearly, we wanted to be able to support multi-factor, and we wanted it to be consistent. And you'll see this in the demonstration that Justin will go through. And just as a point of reference, Justin is actually still working with us and is on our project as we continue to evolve our identity and access program. So he's really the brains, not me. So what you'll see is it's a very consistent look and feel, but it also integrates today with the social media pieces and parts that are out there, whether it's Google or Facebook or things of that nature, and you'll actually see that. So the goal was to create this proof of concept, see if this B2C process could work, and develop then kind of a back of the napkin budget and timeline to submit as a business case, which we did, and we went down that path. And the good news is we're very quickly coming to the end of those 4 constituent groups. We did the brokers first, and then there were a number of different things that went off, and we ended up doing a number of different things. Two of the pieces of the constituents in parallel together. So the project got a little hectic at times because there were multiple paths and streams going through it. But effectively, we wanted to align our rollouts with a number of other projects that were happening at the same time. So in the last box in the lower right-hand corner, the phased rollout for different entities also aligned with our mobile strategy redesign that we were working on, and some of the web changes that we were working on. So Jason's been, or Jody has been working with our web teams to be able to go through and make that alignment and plug that code in. Justin has been. I should know that. That's my son's name. Next slide. So what you see here, and this first bullet is really kind of a lessons learned for folks out there. 700K accounts migrated from a legacy solution to Microsoft Azure B2C. What do I do with all this data? I've got all these old accounts out there. How do I get it into the new format? How do I make, and Frank touched on this a little bit too, is how do I make this solution better for my end user with less work, right? So I've got all this old data, old information. Oh, by the way, for those who may be in businesses where you send out billing statements, stock statements, householding, right? The householding concept. We had a householding concept where Dave Swits could have an email that my wife used, my son used, and everybody under the sun could use to access that information. And now we were requiring a single account for a single person. And so how did we go through that and deal with that? There were a lot of accounts that were migrated. In some cases, we considered, do we just set up new accounts and have them set up those new accounts and go in there? And, on the member side, that's what we ended up doing. And I just did mine. I think we migrated, what was it, just in last week. We did the member pieces, and I did my account Friday night, I think it was. And I had to, use my same email, but I then had to go and set up my new account. So that's a real consideration for any business, for any line of business, is what do I do with the old data that people have been using for a whole bunch of years. The cost savings are pretty astounding when you look at software that isn't supported or is running out of support over time. So, as things get older, they charge more, and the support gets less. And so with the new stuff coming through, the cost savings using Microsoft's solution surprisingly were less costly, and there was some ROI to be had. Bring your own identity. I think Frank touched upon that. This is really cool stuff, and you can see in the right hand corner, Justin's got the screen up, and you can see the links, and he'll show this with Facebook and Apple and Google connectors that we built into that. And we changed the entire UI. The UI, as you see, is very kind of refreshing and new. But yet that UI is the same UI used across those constituent members that we talked about earlier. And as the bullet says about application modernization, it really helped and was at a great kind of juncture for us, because we were redesigning the web and redesigning our mobile app at the same time, and we were able to kind of converge those work streams collectively together. And then we can use the MFA, satisfy the state and the feds, and go on our merry way. So it's not something to be taken lightly. It's not something that you can do in 2 or 3 months. It takes a lot of thought, it takes a lot of effort, a lot of planning. Once you get on that journey and get through the planning, though, it's pretty exciting to watch it uncover. I watched a lot of the sprint work that folks worked on, and Justin showing it as it kind of evolved. And I think that's also the beauty of an agile environment.